Gather the necessary equipment at bedside. So, arranging things conserve time, energy, and avoid unnecessary stretching and twisting of the muscles of the nurse. And then, attach the IV fluid label. Place it on the container. So, remove the tubing from the package and straighten it out. So, this is to facilitate access to the device. And then slide the tubing clamp along the tubing until it is just below the drip chamber. Close the clamp. So, this is to facilitate its access. And then, leave the end of the tubing covered with plastic cups until the infusion is started. So, this will maintain the sterility of the end of the tubing. And then expose the insertion site of the bag or bottle by removing the protective cover. Remove the cap from the spike and insert the spike at the insertion site of the bag or bottle and hang it in the IV pole. So this will connect the tubing set to the intravenous bottle or bag. And then squeeze the drip chamber gently until it is half full of solution. And then remove the protective cap and hold the tubing over a container. Maintain the sterility of the end of the tubing and the cap. So this is to prevent the contamination of the equipment. And then release the clamp and let the fluid run through the tubing until all bubbles are removed. Tap the tubing if necessary with your fingers to help the bubbles move. The tubing is primed to prevent the introduction of the air to the client. And then reclamp the tubing and replace the tubing cap, maintaining sterile thickness. So this is to prevent contamination of the equipment. And then perform hand hygiene. So this is to prevent the spread of microorganisms. Perform hand hygiene. So this is to prevent the spread of microorganisms. So assuming that I have already performed the hand hygiene, position the client appropriately and expose IV site. So this is to gain access to the IV site. And then compare the label of the container to the physician's order. So this is to ensure that the correct solution is being infused. Observe the rate of flow every hour or minute by comparing the rate of flow. Infusions that are too fast or too slow can be harmful to the client. And then read the volume in an IV bag by pulling the edges of the bag apart at the level of the fluid and read the remaining volume. And then observe the position of the solution container. If it is less than 3 feet above the IV site, readjust it to the correct height of the bowl. Too much fluid is infused in time interval, you may need to notify the physician. In some agencies, you may slow the infusion to less than the ordered rate that it will be completed at planned time. And then, Inspect the insertion site for fluid infiltration or extravasation such as swelling. If present, stop the infusion immediately and remove the catheter. Obtain the correct solution container, read the label of the new container, and compare to the physician's order. So this is to prevent the introducing wrong infusion to the client. And then perform hand hygiene to prevent the spread of microorganisms. Set up the IV equipment with the new container, so this is to save the time and effort. Close the roller clamp on the administration set. Carefully remove the cap on the entry site of the new IV solution container and expose the entry site, taking care not to touch and expose the entry site. And then lift empty container of the IV pole and invert it. Quickly remove the spike from the old IV container, being careful not to contaminate it. So using a twisting and pushing motion, insert the administration and spike into the entry site of the IV container. Hang the container on the IV pole. So this is to allow the access to the IV content. Alternately, the new IV fluid container can be hung on the IV pole and insertion on the administration set is done as it hangs on the IV pole. And then slowly open the roller clamp on the administration set and count the drops. Adjust until the correct drop rate is achieved. And then remove the gloves and perform hand hygiene. Introduce yourself and verify client's identity. Explain the procedure to the client. So this is to avoid anxiety and gain cooperation. Validation of client's identity ensures that the right patient receives the intervention. And then perform hand hygiene. So this is to prevent transmissions of microorganisms. And then expose the IV site. Place water absorbent lining under the extremity with the IV site. So this is to prevent the soiling the bed linens. And then clamp the infusion tubing and then apply the clean gloves. So this is to prevent transmission of microorganisms and to protect yourself from fluid contact. Remove and discard gloves appropriately. Perform hand hygiene to prevent spread of microorganisms. And then document all relevant information to ensure continuity of care. And then remove the dressing and tape at the venipuncture site while holding the needle firmly and applying contraction to the skin. And then assess the venipuncture site. So this is to assess for complications, infection, or phlebitis. And then apply the sterile gauze above the venipuncture site by touching only the upper portion of the gauze. This is to maintain sterility of the gauze and provide pressure on the venipuncture site. And then withdraw the catheter from the vein by pulling it out along the line of the vein. Do not press down and sterile gauze pad while removing the catheter. Immediately apply firm pressure to the site using sterile gauze for 2 to 3 minutes. And then hold the client's arm above the heart level if any bleeding persists. Apply the new sterile dressing to the site with the tape. And then discard used supplies according to the hospital's waste management policies. So this is to prevent cross-contamination and spread of microorganisms. Remove and discard gloves appropriately. Perform hand hygiene to prevent the spread of microorganisms. And then document all relevant information to ensure continuity of care.